problems among women is a hidden iron deficiency. And in fact, very few women even know that they have a deficiency. Because they might look at their blood test and see, oh, my hemoglobin is normal, so everything's fine. But actually, it's scientifically proven that even if you don't have anemia and your hemoglobin is normal, you can still have iron deficiency symptoms like chronic fatigue, low immunity, pale skin, hair loss, and poor nail and skin quality. Brain fog sets in, making it hard to focus. Your concentration drops and your memory gets worse. Your hands and feet start feeling cold all the time. This is all linked to an iron deficiency, plus shortness of breath and a rapid heartbeat, which is called tachycardia. Just imagine how many symptoms are tied to iron deficiency. So, what to do about it? How to fix an iron deficiency without spending a fortune? I'll explain in this video. I've done extensive research, gathering all the scientific evidence on this topic. I think that after this video, you'll have all your questions answered and understand how to replenish the iron levels in your body. I'm Dr. Ailes, and let's get started. Friends, iron deficiency is a real epidemic. It is my sincere hope that as many women as possible get to see this video because it contains extremely valuable and highly reliable information. And I would be truly grateful if you would take a moment to like this video and subscribe to the channel, as doing so really helps to promote and share this content across all of YouTube. First of all, let's figure out how to tell if you have an iron deficiency or not. There are 3 stages we can identify over time. The first stage is when your iron stores are being depleted, and this stage doesn't show any clinical symptoms at all. So if you get a complete blood count, all your levels will look normal. Hemoglobin will be normal, red blood cells will be normal, their size will be normal, and iron itself will be normal. If you check your serum iron, it'll be within the normal range, and only through certain indirect markers. Is it possible for you to suspect that your iron stores have actually become completely exhausted? If you happen to overlook this critical stage, and most women don't even know their iron stores are severely diminished, then these women move on to the second stage. The second stage of this process is when you have a completely hidden iron deficiency. A hidden iron deficiency is when changes start showing up in your complete blood count. At this phase, besides the hidden markers indicating a deficiency, your blood profile actually begins to change. First and foremost, the red blood cells change. And so, by looking at those cells, you can already see a hidden iron deficiency. In fact, almost every other woman is currently at this stage. That's according to scientific literature. But if nothing is done at this stage, and a situation worsens, then iron deficiency anemia develops. Anemia is when hemoglobin levels drop, specifically when they fall below 120 grams per liter in women. So, this is a significant drop that can lead to serious clinical symptoms. And of course, at this stage, it's already evident how much the hemoglobin drops and how the hematocrit levels change, along with other markers I mentioned, like changes in red blood cells, ferritin, transferrin, and everything else. Now, let's look at the first stage, which is when iron stores begin to be depleted. When you get a blood test, as I said, you won't notice much because hemoglobin and the overall blood count will generally be normal. But if you get an expanded iron profile, well, then you might. See terms like ferritin, transferrin saturation percentage, and transferrin. It's scientifically proven that ferritin is the key indicator of a hidden iron deficiency. And it's very important to understand that this marker can vary. I can say with certainty, with almost 100% specificity, scientific literature states that ferritin below 15 nanograms per milliliter means depleted iron stores. In other words, there's already a really serious iron deficiency. However, as of 2024, most modern labs have raised this threshold to 30 nanograms per milliliter of ferritin. This is the first marker that indicates you have an iron deficiency. So, if you get blood work and your ferritin is under 30 nanograms per milliliter, it's a reliable sign that you already have an iron deficiency in your body. Although, generally, a threshold of 50 nanograms per milliliter is considered a good ferritin level. Anything below 50 grams is already a sub-threshold value before stores are depleted. Anything below 30 nanograms per milliliter means you truly have a deficiency. But there's one important nuance here. The important thing to consider is, If there's any inflammation in the body, like if C-reactive protein is significantly elevated, then this data won't be accurate or reliable, because ferritin naturally increases during inflammation. So, if there's an active inflammatory process, medical professionals typically look for levels below 70 nanograms per milliliter as a clear sign of deficiency. Meaning, if you have an inflammatory disease or chronic inflammation, the threshold rises to 70 nanograms per milliliter for inflammatory processes that can be seen in the blood. In all other cases, if you don't have chronic or acute inflammation, you should understand anything below 30 nanograms per milliliter is an iron deficiency. And along with ferritin, there's another vital indicator with very high specificity and a high level of evidence. That is the transferrin saturation percentage. And this transferrin saturation percentage, if it suddenly drops below 16%, and plus, if you also have low ferritin, below 30 nanograms per milliliter, then this also reliably shows that you have an iron deficiency. If there are inflammatory processes, then the range, it rises to 20%. So everything below 20%, it turns out, is already an iron deficiency. And it's important to note here that you can look at serum iron in a blood test. And serum iron can be normal, or it can even be slightly elevated, but it doesn't reflect the real picture. This is important to understand because it's very volatile. You can even eat something that has a lot of iron, and your serum iron will start to rise in the moment. Therefore, it's an unreliable indicator. And never look only at serum iron. You must check ferritin and the transferrin saturation percentage. This is exactly why these two markers specifically are the absolute gold standard for accurately identifying iron store depletion. The next condition is when there's already a latent iron deficiency. This condition already manifests in the fact that the body really lacks iron. So if in the first stage only our iron stores are depleted, but overall the body can compensate for this, then at the latent stage of iron deficiency, the red blood cells, which need iron to carry oxygen because iron performs one of its main functions by helping the red blood cell carry oxygen. That is, to bind oxygen. And we need oxygen so that all cells are nourished, because cells, they breathe oxygen. This is exactly what triggers all metabolic processes in the body and in cells, and energy is produced from this. And here, when the red blood cells already lack iron, the ability to transport oxygen is already impaired. And from this, fatigue specifically appears. Exhaustion appears, that is, many symptoms already. This is all due to the fact that cells begin to starve because less oxygen is carried with the blood with the red blood cells. And here there are two key indicators that can show that there's already a hidden deficiency. The body is really lacking. And when you take your blood test, you can see that there are 3 letters there. MCH, that's the mean corpuscular hemoglobin concentration. And this mean corpuscular hemoglobin concentration specifically, it starts to decrease. Therefore, in the latent form of iron deficiency, MCH, accordingly, this indicator will be lower. That is, it will be below the reference values. There's also a second important marker of hidden deficiency, the 3 letters MCV, meaning mean corpuscular volume. When there's less iron, the oxygen carrying capacity is lower. That is, the red blood cell itself becomes smaller. So this means there's already an iron deficiency, and consequently, the red blood cells can shrink and carry less hemoglobin on them. And these 2 markers, plus ferritin, and the transferrin saturation percentage, show the body is starving and lacks enough iron to perform its vital functions. If we do nothing about a hidden deficiency, we move to the 3rd stage, which is iron deficiency anemia. Let's look at what anemia actually is. Anemia is when hemoglobin concentration drops below 120 grams per liter in women and below 130 grams per liter in men. So this already indicates anemia and, consequently, a low concentration of hemoglobin. If we're talking about iron deficiency anemia, what do we see here? What's the picture? Besides hemoglobin dropping below 120 grams per liter in women, the number of red blood cells decreases. Hemoglobin is tightly bound to these cells. If hemoglobin drops, if the red blood cell concentration drops, if the red blood cells, there's another important marker. It's 3 letters, RDW. That's the red cell distribution width. In simple terms, red blood cells should generally have a uniform shape. If there's an iron deficiency, then the red blood cells, some might become small, some larger. Their sizes can vary significantly. If you get a blood test and it shows a high percentage of varying red blood cells, that also indicates an iron deficiency. And along with this, what happens in iron deficiency anemia? Our serum iron decreases. Obviously, all the stores are in trouble. Serum iron is in trouble. Hemoglobin is low. Red blood cells are also low, and hematocrit might decrease too. Consequently, the cells become pale because, well, the color is also determined by iron. And all of this, of course, is accompanied by serious symptoms when the body is in an exhausted state. There's severe chronic fatigue, weakened immunity, other serious comorbidities, pale skin, hair starts falling out terribly, skin begins to age faster, and nails deteriorate. This is all linked to iron deficiency. Additionally, tachycardia occurs along with cold hands and feet. So that's the terrible picture. And the most tragic part is that according to WHO data, in various regions of the world, iron deficiency anemia can occur. In up to 30%. That means up to 30% of women may suffer from iron deficiency anemia. An enormous number. And of course, women are primarily the ones suffering from this problem. Why? Because during their periods, significant bleeding and substantial blood loss occur. And the more intense and heavy the menstruation, the more iron can be depleted from the body along with the blood. Moreover, if there are also gastrointestinal issues, or if, for example, the girl is a vegetarian, then of course, all of this only. It makes the situation worse. Friends, if you found yourself at any of these stages, please write in the comments, share how you feel and what your levels are. Maybe tell us what you've done to try and solve your problem. Ladies and gentlemen, you're probably wondering now, what should we do about this? You've likely identified a stage you're in, but first, we need to understand why this problem even occurs. If you're a woman of reproductive age, your iron deficiency is most likely caused by blood loss. But there are other reasons too, and this reason is related to a malfunction of the digestive system. Because essentially, whereas iron absorbed in our bodies, it's absorbed right in our digestive system. And if there's any inflammation in the lining of the stomach, or if there's malabsorption syndrome, which is when nutrient absorption in the gut is impaired due to inflammation, then of course, iron levels will naturally be significantly lower. An endoscopic exam of the upper and lower gastrointestinal tract is very important here, because there might be a source of hidden internal bleeding. It could be an ulcer, or it could even be a malignant tumor, such as the development of colon cancer. And that can lead to iron deficiency. So the first one is blood loss. That's a very common cause. Second is anything related to impaired iron absorption in our digestive system. Third, there is the issue of hidden blood loss, occurring deep within the gastrointestinal tract, often due to the presence of internal ulcers or various tumors, or some other inflammatory issues. Fourth is consuming foods with a low iron content. This especially applies to vegetarians, because those on a vegetarian diet, especially vegans, have iron intake below the normal levels. So, if you're on such a diet for a long time, it leads to iron deficiency. Also, it's important to mention that if you have chronic inflammation for some other reason, like rheumatoid arthritis, a chronic infection, and so on, all of that also impairs iron absorption. In other words, any inflammatory process inhibits iron absorption and leads to a deficiency. And I can even say that during things like breakfast or lunch, people often wash their food down with tea or coffee. And what are you actually doing? When you eat a portion of food, it contains vitamins and micronutrients, including iron. But if you enjoy drinking a cup of coffee or even tea with your daily meal, they contain tannins that effectively bind the iron. And up to 70 to 80% of the iron in the food you've eaten just doesn't get absorbed, because you're constantly washing your food down with coffee or tea. So, we've now looked at the different stages of iron deficiency and what the possible causes for this deficiency might be. And now, let's figure out how to replenish this deficiency And let's also start with the simplest stage, when iron stores are depleted. What we can find out from our ferritin levels. Actually, 1 unit of ferritin, which is 1 nanogram per milliliter, is equal to approximately 8 to 10 milligrams of iron in our body, meaning stored iron. It turns out that from 50 nanograms per milliliter, or micrograms per liter, that's the norm, so anything above 50. If we exclude any inflammatory processes, because if there's inflammation, this formula doesn't work. In those cases, even 80 micrograms per liter could be a deficiency. But if we assume you're in a state of general good health, which essentially means no inflammation, then a ferritin level of 50 means there's about 500 milligrams of iron stores in the body's storage depots. 500 milligrams is considered the norm. If, consequently, this store decreases, then the risk of developing a deficiency increases, especially if you've, say, had a serious illness or been under physical or mental stress. All of that increases consumption. So it's very important to keep your iron depot at a normal level. That's approximately 500 milligrams, meaning you want at least 50 micrograms per liter of ferritin, and ideally even 60, 70, or 80. And if we know that 1 microgram of ferritin per liter is, rounding it off, 10 milligrams of iron. So you can calculate for yourself right now what your deficiency is. Well, for example, if your ferritin is currently 9 or 8, then you subtract 9 from 50. What do you get? You get 41. We multiply 41 by 10 milligrams, and that gives us, that's 410 milligrams. So, at least 410 milligrams. Your body is lacking, even if all your other indicators are normal. So if your complete blood count is normal, if your hemoglobin is normal, but your ferritin is 9, then you need to gain 410 milligrams of iron. And now we move on to the next topic. How do you actually get those 410 milligrams of iron? Well, look, you can do it through diet, of course. And here you see a picture. These are iron-rich foods. So overall, if you don't have a latent iron deficiency yet, let alone anemia, there's still a chance to get it from food. But you really have to focus on these products. Eat meat, eat liver, and other things. But I'll say it's quite difficult to replenish through food if a deficiency already exists. For maintenance, it's fine, but for replenishing a deficiency, it's hard. So I recommend using supplements to replenish iron stores. Meaning there's divalent and trivalent iron. Trivalent iron is more expensive, so to save money, you can choose divalent iron. These are fumarate, sulfate, gluconate. I can say that divalent iron, well, basically all the supplemental iron that we take is pills. You know, orally, they have a relatively low level of bioavailability. So, it is important to note that on average, only about 10 to 20% of the iron you take is actually absorbed. So, if you take a 50 milligram iron pill, only about 10 milligrams of iron will actually be absorbed. Iron can irritate the stomach, so I recommend taking forms like iron bisglycinate that irritates the stomach less and provides approximately 20% bioavailability. Sometimes it can even be as high as 30% bioavailability. There are other forms of divalent iron that give about 10 to 15% bioavailability. So, that means if you take, for example, 100 milligrams of iron, only 10 to 15 milligrams of iron will be absorbed in your GI tract. And there is, of course, also trivalent iron. And there are liposomal forms. There are different varieties of trivalent iron there. Basically, only liposomal iron has high bioavailability. About 30% of it is absorbed, and overall, it doesn't irritate the stomach, but it usually costs more. So, overall, choose divalent iron. You can choose the same bisglycinate form and take that. If your ferritin is 9, then it turns out you need to replenish 41 micrograms per liter of ferritin. As I said, 1 microgram per liter is approximately 10 milligrams of iron. And now we also need to consider bioavailability. Even if we take a good bioavailability of 20%, so you need to multiply these 410 milligrams by 5, because 20% is 1/5. we get 2,000. It turns out 50. That is 2,050 milligrams. We need to consume additional iron supplements in order to effectively restore our body's levels of ferritin, to increase it from the number 9 to 50. Taking all of that into consideration, you now have to calculate a rough estimate of exactly how much iron you actually need to take per day. In the event that you find yourself needing to take 2,050 milligrams, it is essential that you carefully select a specific dosage schedule that works for you. It could be, for example, 50 milligrams a day or 100 milligrams a day. You could, of course, do it at an accelerated pace and do it in a month. But it's very important to monitor your blood levels here. If we do it gently, without rushing, for example, over 3 months, then we divide by 90 days, and it turns out you need to take an extra 23 milligrams a day. That's extra. If you want to replenish it very slowly, that's on top of the 40 milligrams a day daily allowance you still need to consume. So it turns out you need about 40 milligrams of iron to consume per day. But actually, if you do it that way, it might not be effective enough. If you consume 2,050 milligrams over 30 days, then, accordingly, you need to take an extra 70 milligrams of iron daily. And plus, don't forget that you need to cover 18 milligrams of iron a day if you're a woman of reproductive age, because there's blood loss, and that's 18 milligrams. For men, it might be less. It could be 10 to 12 milligrams. So you should calculate 18 milligrams plus, considering your deficiency, how long you want to recover, 30, 60, or 90 days. If we take a month, then it turns out you need 70 milligrams a day plus another 18 milligrams. That's 88 milligrams of iron you need to consume daily if you want to sharply raise your ferritin to 50, for example, from 9 to 50 in 30 days. If you do it over 60 days, then, accordingly, you can do it, for example, by taking supplements of, say, 50 milligrams a day. That's how you can calculate how much iron you have in your body now, how much you need, and, accordingly, replenish iron that way. And what I would highly suggest, of course, is checking at certain regular intervals your ferritin and transferrin saturation percentage. I want to say something important. When you take iron, depending on how you take it, there will be a different result. From that level I mentioned, you should understand that if you take iron on an empty stomach, it increases absorption, and then 20 to 30% of that iron can be absorbed. If you take iron right after a meal, then the absorption of that iron drops by 30 to 40%. That's an important point too. There's also data that if you take iron with vitamin C, it increases its absorption by about 30 to 40%. Although I found recent scientific data from the last few years quite reliable, which didn't notice really big changes, whether a person takes just iron or takes it with vitamin C. But overall, you can take it with vitamin C, but it's no guarantee that vitamin C will boost absorption. First and foremost, it's important to take it on an empty stomach and not mix iron with other trace elements. Because if you mix iron and take it with zinc, for example, or magnesium or other trace elements, then those other trace elements, they compete with the iron. And accordingly, iron absorption will drop by 30 to 40%. And also with calcium. That is, calcium, zinc, magnesium shouldn't be mixed with iron. So it's best if you wake up in the morning and take it on an empty stomach. And it's best to take iron in a stomach-safe form, like bisglycinate or a liposomal form of iron, to irritate the stomach less. And another important point that many underestimate is that when you have breakfast, for many, the day starts with a cup of coffee. Because if you drink tea or coffee, iron absorption drops by 70 to 80%, and it'll all be for nothing. Even if you take high doses of iron, the absorption rate will be low. So what you need to do is take your iron on an empty stomach and wait an hour and a half to 2 hours for tea or coffee. Ideally, you want a window of up to 2 hours, at least an hour and a half to 2, if you want the best possible results. And of course, it's important to take it regularly here. I recommend doing this every single day. Although, actually, there's an interesting point from recent scientific studies. They suggest that iron is absorbed better if you take it every other day. This is because, in response to iron, the body produces certain substances that can inhibit iron absorption the following day. So, Overall, it's better to take larger doses of iron every other day. But there's a catch. Many people simply forget to take their iron every other day. And that's why even those same scientific studies say it's still better to take it daily on a consistent basis than taking it every other day and forgetting. So, my friends, that's how the situation stands. If your issues aren't severe, meaning you don't have anemia, you can use tablets or oral supplements to effectively compensate for any deficiencies. But there's one caveat. If you have GI inflammation and iron absorption is impaired right in the stomach, it might make sense to start for iron. Because with intravenous iron administration, bioavailability is practically 100%. It's through and for that you can very quickly replenish an iron deficiency, especially if you have serious gastrointestinal issues. And now we're moving on to more serious forms. Everything related to latent deficiency and anemia, where there are already serious clinical manifestations. This already requires the administration of large doses of iron. And there are even medical formulas for how to calculate this. But generally speaking, if you already have anemia, I definitely recommend seeing a doctor who can calculate the correct dosage for you to take via tablets or even intravenous injections. I just want to briefly mention that, for example, there's the Ganzoni formula, which can calculate the total iron requirement. And it's equal to body weight multiplied by the difference between the target hemoglobin level and the actual one. So, for example, if you want a hemoglobin of 120 and yours is currently 100, that's 20. That's grams per liter multiplied by a factor of 2.4 plus 500 milligrams of iron. I'll just give you an example. I already have a calculation here for a woman, for instance. If a woman weighs, say, 60 kilograms and her hemoglobin is 95, that means it's already a serious deficiency. That's anemia. The goal is to at least get to the lower limit of anemia, which is 120 grams per liter. Based on these calculations, you'd need to infuse 4,100 milligrams of iron. And in fact, it's already extremely difficult to do that with just pills. Just imagine, 4,100 milligrams of iron must be absorbed by the body, considering that the absorption rate can be from 10 to 20%. If, for example, it's at 10% or even at 15%, that means you'd need to consume 27,000 milligrams of iron. That's even if you take a high dose of this iron at 100 milligrams per pill, 100 milligrams of elemental iron. This is, for example, if you take ferrous gluconate, right, or sulfate. There's sulfate in there. That's 70 to 80%, and only 20 to 30% is elemental iron. Imagine what kind of dosages you would need to take. That means consuming 27,000 milligrams of iron, pure elemental iron, 270 pills. That is extremely difficult to do. So, friends, if you already have anemia, a diagnosed anemia and low hemoglobin, then you absolutely must see a doctor. And you need to have it administered intravenously in large doses. Iron for replenishment. Because if you just go, I don't know, to a marketplace with anemia and order iron for yourself and start taking it, I don't think it's going to make any difference at all. You can only do that if you have depleted iron stores, but it's still a hidden deficiency. But if your hemoglobin has already dropped significantly, then medical help is mandatory, including intravenous iron. Friends, I hope it's clear to you now what you need to do. I certainly recommend that all of you women replenish any deficiency. Remember that you need to consume at least 18 milligrams of iron a day, and this iron should be taken separately from other substances. Better on an empty stomach. Don't mix it with cottage cheese or other things that contain calcium. That's if you don't have anemia yet. But if you have anemia, then of course you need medical help and even intravenous iron administration. That way you'll just replenish it faster, and then just maintain it. I'll remind you that there could be hidden conditions in the gastrointestinal tract. There could also be hidden blood loss there. And I want to take this opportunity to remind you that if you choose to ignore this condition and have a chronic iron deficiency, it will eventually result in the development of comorbid diseases in various systems. Because your immunity will be lowered, cognitive functions, your brain will work worse. Your body will work worse. You'll be physically tired. And this is particularly crucial if you're preparing for pregnancy, as it's exceptionally hazardous and risky to have an iron deficiency during pregnancy, because it's well documented and scientifically proven that children born to women with a deficiency are at significant risk. Children who are born to women with a significant nutritional deficiency are at a much higher risk of autism. They can actually have twice the risk, according to the various scientific studies that I have right here, of having a lower overall IQ score compared to their peers. So, this directly impacts the development of the fetus and the child. Of course, this also leads to premature aging. Because if our skin and collagen don't get oxygen and nutrients, everything just ages. So, ladies and gentlemen, watch your iron levels, get regular blood tests, check your ferritin, transferrin saturation, and hemoglobin, and correct it in time. I've also given you a formula for how to raise ferritin quite quickly using dietary supplements, provided you don't have anemia. Well, that's all for today. This was Dr. Alice, and I'll see you next time.